The Alcon CZ70BD has two eyelets, making it also useful for suture fixation. In terms of the pros, this lens is hydrophobic. We know that hydrophilic lenses may potentially opacify if they come into contact with gas or air, and an example of that would be the Acryos lens. Number two, it has a 7mm optic. Most IOLs have a 6mm optic. This makes it more forgiving for any possible decentration. Number three, this lens, unlike most lenses, this lens is PMMA. Most lenses are acrylic. And this makes the IOL very strong and durable. And there are no concerns about eyelid fracture that I mentioned in regards to the Bausch & Lomb Invista sutured IOL. In terms of the cons, well, I did mention the PMMA as a pro, but it's also a con because PMMA lenses cannot be cut, they cannot be folded, and so when you're trying to put this lens in, you're going to require a very large incision, and I would advise a very large scleral tunnel. Otherwise, a very large corneal incision to put this lens in would induce a lot of astigmatism. So you'd have to be comfortable doing a scleral tunnel and making a very, very large incision. Number two, it provides 2-point fixation like the CZ70BD or the Yamane technique in terms of its two eyelets. And so, of course, the greater the point fixation like the Acryos, the better. And lastly, it does not provide astigmatism correction, unlike the Bausch & Lomb Invista, which would provide toric correction. So, for example, if a patient left aphakic because of a violated capsular bag, has 2 diopters of corneal astigmatism, for example, or even more, and you put this lens in, well, although you're going to place this lens in, you will not be able to address the patient's astigmatism. In terms of, just as a side note, so now that we're done with pros and cons, in terms of passing the suture through, I do recommend Gore-Tex, and some advocate doing the cow hitch technique when passing the suture through the eyelets, and some simply pass the suture just directly through the eyelid. I hope you found this video to be useful for you.